So today we're discussing our first aid kits and how they can be used for different species. Today we're going to be looking at a small citizen and how to provide supportive nutrition for that bird. So when you're choosing your first aid kit, you're able to basically plan which bits you need. So for a small citizen, we're going to be using the Emerade Omnivore. And then we have a variety of crop tubes that you can choose on our kit. There's about 8 different sorts, and we're going to be choosing this one for the bird today. So for the rearing foods, for the supportive care foods we've got, they come in powder format. So this is the right product for the birds. Get them in a little bowl. This is where I'm going to get it all wrong because I'm going to mix up too much, but you want warm water. And then the plan is you've got to make this into a nice paste. Possibly a little bit on the thick side. This is where, can I get it right? Just enough. So we've got really quite a nice consistency that we need. They're thin enough that you can tube it, but obviously it's keeping the calories present. Just going to use the 1 ml syringe today. And then basically that's going to draw nicely into the syringe. You will get a little bit of air bubbles in there maybe, and you can just flick that down. Got your crop tube, and you don't want to introduce air, so then we just want to compress that down until we get the material, so we've got a full tube as well. When dealing with small birds, their metabolic rate is very high. So any sick bird, any bird that has been during transport, or for any reason really, they need to feed quickly. And you can do that by giving them their favourite foods, which obviously will help them feed themselves. But syringe feeding in the way that we're doing here is really the next level for providing supportive care for the birds. It is a technique that you might require advice on or assistance on how to do. It's something that people with large number of birds would probably be doing routinely, but for individual pets, people wouldn't. And your other option there is to give them some syringe food by mouth, which we'll also show you. The other reason for giving supportive feeding, as we're doing here today, is to help get medications into the bird. So medications can be distasteful, or the bird can try to regurgitate, vomit if you like, the contents back up. So if we mix them with the rearing food, the supportive care nutrition food that you've got, it makes them less distasteful and better for them to take. So the bird we're going to be using in today's video is a bird that's actually being medicated, so we've actually pre-mixed that in with the rearing food, ready for crop feeding, aiming that the bird then hopefully will have less of an unpleasant taste and less likely to regurgitate. So if you're going to medicate your bird by mouth, or you're going to provide some supportive nutrition by mouth, we've got our little towel again for handling. We have our bird in a suitable environment to restrain it from. Get your basket undone ready, and if you're worried they're going to escape, you can actually just feed your towel through under the lid so you've got it nice and secure before you start. You're then finding the bird in the box, which we've got here, and you may want to just do a little bit of adjustment so you've got the bird nicely restrained. I'm left-handed, so this is going into my right hand. You'll have to transpose this for right-handed people. And what I'm actually going to do is just gently restrain the head here with these 2 fingers, just so I've got the beak in the right position. And you can see I get bitten if I put my finger there, so don't do that. For syringing medication in, the bird will try and bite the end of the syringe, but we can then just give a little bit of medication, and the bird will hopefully swallow that to take the medication that way. So you can do this with supportive nutrition, but obviously the amount you can give to avoid the risk of aspiration from the bird really is quite limited. But for medication that you're giving at home, this is a good way of guaranteeing the bird gets its medication that it needs, as opposed to relying on in-water treatment. For crop feeding a bird, and as I said, this is the next level in terms of supportive care, and it may be something that you feel for an individual pet owner is something you don't really want to be doing to your bird. And I get the reasons for that, because you've got a pet owner bond there and the bird is not going to necessarily thank you for having its tummy filled up. If that's the case, then that's fine. That's something for the vets to do, for us to do for you. But I thought to show you the procedure such that you can see what that involves. And certainly for breeders or keepers of larger numbers of birds, this is something they would practice and do themselves. But it can be quite daunting for a new owner. We have our towel again, passing it through the box to ensure the bird doesn't escape. And same again, we're catching, restraining the bird round the wings, making sure the head, one finger is here, my thumb is here, so I've got a nice position of holding. Free movement to breathe here, okay? This bird is not being squashed by my lower hand at all. I've got all the room in the world down there, okay? But the wings are restrained. The syringes we use and the feeding tubes we use, this is too big to go down the bird's windpipe. That's the first point with the bird of this size. You cannot put this down the bird's windpipe by accident. The bird will bite it as before, we have in the last video, and we're just going to raise this up behind the tongue, which I've just done there, and then this will slide quite nicely down into the crop. Now I can feel that with this finger. I can feel that rounded end with that finger here, so I know I'm in the right location. And then slowly, gently, we put the material into the crop of the bird. So this could be medication in here as well. We can then pull the crop tube out. That's the bird. Do not compress this area because you've just put food in it. And then you can pop the bird back into its container, and the bird expresses its disdain for having been fed. But we've got calories in the bird, we've got fluid in the bird, we've got medication in the bird. So for supportive care, it's a key skill that you need to help this bird recover.